You know, in medicine, you run into these choices where there are just no easy answers. Moments that push doctors, patients, and their families to the absolute brink. Today, we're going to dig into an ethical framework that was designed for exactly those moments. We'll use a real-world dilemma to see how we can find a way forward when it feels like every single option is impossible.
So let's just dive right in. Our starting point is a patient who is facing a truly devastating diagnosis. And this isn't just some abstract thought experiment, okay? This is a real case that forces us to look at a huge ethical challenge head-on.
Okay, so picture this. You have a 27-year-old woman. She's 5 months pregnant, and she gets a diagnosis of stage 3 endometrial carcinoma. Her doctors are very clear. The only thing that will save her life is a total hysterectomy. I mean, the stakes just could not be any higher.
Right away, this diagnosis creates this immediate, just heartbreaking conflict. The very treatment that could save the mother's life is going to end the life of her fetus, who's just too young to survive outside the womb. And this puts an absolutely impossible question right at the center of this whole story.
And this brings us right to the patient's own words. Her question is so raw, it's so direct, and it's so deeply human. She asks, does saving my life mean I am killing my baby? I mean, how do you even begin to answer that? How can her medical team or she herself possibly navigate that question?
Well, in a situation like this one, where every path leads to a tragic outcome, our emotions can just be completely overwhelming. And that's exactly why we need something more than just gut instinct. We need a structured framework, a tool that's designed specifically for these kinds of no-good option scenarios to help us find at least some clarity.
And that tool is called the principle of double effect. Now, it doesn't promise some easy, magical answer. What it does is offer a clear process. It helps us look at an action that has both a good effect, in this case saving the mother, and a really bad one, the death of the fetus. It lets us break that single action down into its core pieces so we can understand the true intent and the actual outcome.
So let's see how this actually works when you apply it. The principle of double effect gives us 5 very specific conditions that have to be met for the action to be seen as ethically acceptable. So we're going to take this 5-step checklist and apply it directly to our patient's hysterectomy.
Okay, let's walk through this ethical checklist step by step. First up, is the action itself evil? Well, no. A hysterectomy is a standard medical procedure. Second, what's the actual intention here? The goal, the reason for doing it, is to cure the mother's cancer. It's not to end the pregnancy. Third, causality, and this one is absolutely crucial. The bad effect is not the cause of the good one. We'll break that down in just a second. Fourth, are there any other options? Is this a last resort? Yes, her doctors have confirmed there's nothing else that will save her. And fifth, immediacy. The good effect, which is removing the cancer, starts happening right away.
Now, this slide really helps us understand that crucial third condition, the causality part. If you look at the top, you see the correct chain of events. The hysterectomy leads to the removal of the cancer, which in turn leads to the mother being cured. The death of the fetus is a tragic and unforeseen consequence, but it is not what causes the cure. See on the bottom, the bad outcome does not cause the good one. Think about it. If the patient wasn't pregnant, the hysterectomy would still be the cure. They are 2 separate effects of the very same action.
So by walking through these 5 conditions, we've gone from a totally overwhelming emotional question to a structured ethical analysis. So what does this whole process actually reveal about the patient's impossible choice?
Well, the conclusion, according to the principle of double effect, is pretty clear. Because the hysterectomy meets all 5 of those conditions, the action is considered ethically justifiable. Now, this doesn't take away the sorrow or the tragedy of the choice, not at all. But what it does do is provide a reasoned ethical foundation for moving forward with the treatment to save the mother's life.
And this really gets the heart of why a framework like this is so powerful. For doctors, for patients, for families who are caught in an unthinkable situation. Its true value isn't just getting a final yes or no. It's about having a clear, rational, and compassionate process to guide you when your emotions are just completely maxed out. It gives you a steady path to walk through the storm.
So we'll leave you with this question to think about. This case, of course, is specific to medicine. But the need for clear thinking when we're in a crisis, that's universal. So how can structured frameworks, like the one we've talked about today, help all of us navigate our absolute hardest choices, not just in medicine, but in life, with a little more clarity, confidence, and compassion?